Divya, we hear a lot about have safe sex, right? So can you just talk a little bit about that and define what safe sex really means?
So by and large, we do not have an exact definition for safe sex. So what is safe sex basically? When you're having sex with someone that does not make you susceptible to any infection or any abnormality. Now obviously when the number of partners increase, when the number of experiences you're having with others increase, and when you don't know that person's history or sexual history, it becomes a sort of unsafe experience.
Correct.
So what we can say is having safe sex is having sex with a particular partner who you know everything about and the partner knows everything about you.
Got it.
And you both are the only people that y'all are having sex with.
Got it.
Even though it sounds like a very traditional term that we're using right now, because right now people are having so many multiple sexual partners and it's completely okay to have them, but this is what by definition is safe sex.
That's amazing, because I really thought it meant like contraception. I'm like, that's safe sex, not to get pregnant, but that's great. Like, so that leads me into STIs, right? That's basically what you mean, to keep them safe from any sort of infection and diseases.
Exactly. So now once we speak about safe sex, it's something that is safe. Now when we talk about contraception, there are, now see, someone having safe sex can also want to get pregnant, right?
Correct.
So contraception does not get included in the definition of it.
Correct.
But you know that you're safe when you're not eventually having a disease or an infection through the sex you're having, through the experience you're having.
Yeah.
Right? So like I told you, we can't have a particular definition. Now there are ways and there are multiple guidelines where we can make safe sex safer.
Okay.
In terms of not getting pregnant, in terms of not having the infection at all, even with that single partner you're having sex with. Talking about guidelines about safe sex, one will be, please try and limit yourself to just one sexual partner.
Okay.
That is like a major change you can make in your lifestyle if you want to be sure that you're safe and you know you're not susceptible to infection. Second would be that even when you're having sex with just one partner, always try and use a barrier contraceptive.
Okay.
Why I'm saying a barrier contraceptive is because when you're using contraceptives like oral pills or intrauterine contraceptive devices or patches or other injectable drugs, that's not really saving you from STIs.
Correct.
You're still susceptible to infections.
Yes.
Now what are sexually transmitted diseases? Someone touching you, I cannot give you a sexually transmitted disease if I'm touching you. It's not contact. It is dependent on contact and exchange of fluids.
Correct.
Always. So there is a myth around kissing, whether or not it causes STIs or no, it does. Kissing can cause an STI, but to a certain extent only. There are only just the HPV and CME viruses can get through via kissing.
Okay.
Then there are a lot of bacterial, parasitic as well as viral STIs that can be transmitted through exchange of body fluids, whether it is vaginal, oral or anal sex.
Okay.
So always use a condom. A male condom can be used that is most easily available, that is most easily usable.
Yeah.
Then there's something called a female condom, which not many people know about, but yes, that can be used as well. Then there are dental dams, even for oral sex, where you're protecting your mouth from the exchange of those fluids.
Correct.
So that is another factor. Moving on, you can always ask your partner about their history, because this is something so intimate, right?
Yeah.
If now someone has started dating someone new, they can always ask them if they've had any history of any infection, or whether they've taken any treatment for it, or if they're experiencing any rash, blisters, sores. It's always okay to know the intimate secrets of your partners. So please don't feel shy in asking your partner or someone you're having this intimate relationship with about their history. It's very important, and be okay giving them answers about yours as well.
So even though people are having multiple partners, I feel like it's okay to just like stop for like 20 seconds and be like, okay, can you just like tell me? I know it sounds very like off-putting, but it's your health. It's not worth risking your entire life to one disease just because you were feeling awkward or if you didn't want to stop the flow. I think it's so important to protect you. Like, you come first, so protect yourself, protect your insides before any damage can happen. So prevent it rather than taking the cure forever, right?
Coming to using, like I said, barrier contraceptives, even spermicides and jellies are known to be barrier contraceptives, but a lot of times they do not work against STIs. So
Okay.
I would always recommend using a condom. I would always recommend using a non-natural material condom like
Okay.
latex or polyurethane.
You would recommend latex?
Yeah, I would recommend both of those. So please use those. Don't use natural ones because there are high chances of them dissolving and them not working and not doing the job they're supposed to do. Avoid douching. Do you know what douching is, Malvika?
Yeah, I think cleaning the inside, right?
Absolutely.
Yeah.
So there is an age-old practice where women try and push water, vinegar, and
bathroom
salts.
cleaner back in the day.
Exactly. Bleach and all these kind of things into their vagina to clean it, and they think it's something that will help them avoid infection and help them, clean the entire area. That is not true. It increases the chances of pelvic inflammatory diseases, increases the chances of infections, makes the vagina extremely dry, flaky. Please do not douche after you've had sex. It's not helping at all. It's making it worse. If your partner has had any bacterial or viral infection, it's only going to help the bacteria go more into your vaginal canal than come out.
Wow.
So please avoid douching.
Yeah.
Also, this is something that we cannot tell the new generation right now, and we ourselves, it's okay to be under the influence of alcohol and drugs and have sexual activity. That's what people are doing, and that's completely their choice.
Yeah.
But one is more susceptible to infections when one is doing these high risk things, right?
Okay.
Because when you're under the influence of alcohol or drugs, you're not thinking straight.
Correct.
You're not understanding what exactly is happening with you. You don't know how your partner is, who your partner is, and sometimes you don't even know where they come from. So be careful with that. Try not, indulging in these things before having sexual contact. Try and make it more of an emotional connect than just a physical contact.
Yeah.
Last but not the least, need of the hour, get vaccinated. Please get vaccinated for the HPV, that is the human papilloma virus.
Yes.
I have been advising this to all these girls, and it's a vaccine that has come out very recently.
Okay.
It's expensive, that's true. Our government has not been able to do much about, subsidizing those prices and making them available at lower cost, but they're trying, we're trying. If you can afford it, if you can afford it for people around you, like your helpers, people who help you out, and if you can get their girls vaccinated, make sure you do it for them. It's going to be a huge charity towards, the females around the country. So make sure they get vaccinated. I'll be speaking more about the vaccine, when it should be taken, and which brand is more recommended in a few minutes.
Yeah. So what does this help prevent, like the HPV vaccine, and how effective is it?
Okay, so now the HPV is basically the human papilloma virus. Now there are, just like you've heard of the COVID vaccine coming and helping fight COVID, the same way this vaccine is made to fight infections like STIs.
Okay.
So the human papilloma virus has different strains.
Correct.
And the different strains cause different infections in our bodies.
Correct.
Okay. So these infections could be in the mouth, these infections could be around your genitals. All of these are caused by HPV, and it's the major cause of cervical cancer.
Oh.
So getting the vaccine can also help one prevent getting an eventual cervical cancer.
Wow.
So it's very important that one is vaccinated and one does not make themselves susceptible to eventually having cervical cancer. Cervical cancer is one of the most common cancers in India, and it goes undiagnosed for years. And there's nothing that can be done about it except surgery and then chemo and then radio. You continue to go through that cycle. So why go through that when a simple vaccine in this day and age can help you?
Wow.
So once a female gets sexually active, that is around the age of 18, she can take the vaccine. The advisable age is between 9 to 13 years. But in India, girls still aren't being given the vaccine at that age. It is supposed to be given at that age, but these are things abroad and they'll take some time to come to India. So if the vaccine is taken between 9 and 13 years of age, it has to be taken in 2 doses.
Got it.
Now there are 2 brands, one is Cervarix and one is Gardasil. You can decide which brand you want to take. Gardasil is protective against 4 strains, whereas Cervarix is protective only against 2 strains.
Okay.
So I would advise one takes the Gardasil one, right?
Okay,
so the more protection you have, the better. After 15 years of age, if you're taking the vaccine, you'll be given the vaccine in 3 doses.
Oh.
So once you go to the doctor, you'll be told whether the vaccine has to be taken at 0, 1 and 6 months, or 0, 2 and 6 months, or 0 and 6 months.
Okay.
Depends, right? Now the vaccine is a little expensive. Each vial costs between 1500 to 2000 depending on where you get it from. So the entire dosage will cost around 5 to 6000. Fortunately, people from our strata of society, if they can afford it, they should get it. And please help people out and girls out around you and get it. Now, a lot of people have asked me that, you know, I'm 26, I'm 28, I'm already sexually active. Should I be taking it? Will it work? So there is a lot of controversy around that, whether it should work or not, but why not just take it, right? So there have been a lot of studies where women can take it up to the age of 45 years as well.
Yeah.
So if you're sexually active, whatever age you're at, if you figured that you must take the vaccine, you should go and get it, please.
Yeah.
Other than that, something very important about cervical screening is the pap smear test that we just spoke about. So pap smears are nothing but a test of the cells around your cervix.
Yeah.
There are 2 ways we can do it. In one, what we do is the speculum, like I told you earlier, the speculum is inserted, a small candy stick is put inside, cells are collected from the outer and inner part of your cervix, sent for testing. These tests will let us know whether there's any abnormal cells in your cervix that are precancerous or cancerous.
Okay.
Right?
Yeah.
Other than that, we have some advanced tests known as the liquid-based cytology, where a brush, a very tiny brush, is entered into the cervix. Cells are collected from the inner and outer part again, sent for testing. The lab will tell you whether there's any possibility of infection, whether it's precancerous, cancerous or not.
So good.
It's as simple as that.
Yeah.
So once a woman is sexually active, I would advise she gets tested with the pap smear every 2 years at least.
Okay.
If she has 3 consecutive negative tests, then she can continue getting tested every 3 years.
Got it.
After the age of 65, one need not get tested if they've had multiple negative tests.
Got it.
And in case someone has a positive test with HPV or had any precancerous lesions, one must get treated after getting tested.
Correct.
Once the treatment is done, they need to continue getting tested every year.
Yeah.
This is something our moms haven't done. I am ashamed to say this. I have never been able to send my own mom for a pap smear. And I'm very openly going to say it. I feel sad about it.
Same.
But women are so scared and so afraid. And should I say indifferent? They are like, dekha jayega.
Dekha jayega.
Hoga to dekha jayega.
We'll deal with it then.
You know, Malvika, I'm going to be very honest with you. I myself have just got one pap smear done in my life.
Okay.
And I'm totally okay saying that because this is the kind of society and community we've grown up in where nobody's spoken about it. Nobody's gone and said, nahi, every 3 years pap smear karwana hai. And when I started studying is when I realized ki I have to have it done. I have to educate people and make them aware of having it done.
Yeah.
What about you? Have you got a pap smear?
Never. I have never gotten a pap smear in my life, but I definitely will. I think it's a date. It's a lunch, coffee and pap smear.
Pap smear.
That's upcoming weekend plans. But I think girls, please get your pap smears done. Do some more research if you feel comfortable, and you can see all like animated processes of like how it really happens. If you feel comfortable, talk to a doctor. Get papped. Talk about contraception a little bit because I think it's very important for all my young girls and boys and all of y'all who are young watching me. So I recently got married last year and I really want to enjoy my marriage, and I don't want any accidental pregnancies. I don't want that to happen. I want a very planned one if I ever wanted one.
So here's a few contraceptives over here.
And these are some other things you guys can look up online because it'll take ages if we sit here and explain, but these are the most common ones used.